So the temporary overnight closure that we've had in place in our emergency department, which means that we are shut between the hours of 10 at night and 8 o'clock in the morning, has been in place now for 2 years. That's demonstrated to us that we're able to consolidate the staff that we have into a shorter period of time and provide much better and high quality care for the vast majority of our patients. We recognise, however, that some patients are travelling elsewhere at the moment, and so the Healthy Weston plans are looking at ways to provide care over 24 hours that don't require the emergency department to be open. So direct admissions for patients who directly need to come into hospital can be done in different ways. We've already done that with patients who have fallen and potentially fractured their hips. Those patients now come in directly to our wards, bypassing the emergency department, and actually we provide better care for them. By extending that to other patients with medical conditions, we hope that eventually we will be able to provide safe, good quality care overnight for the vast majority of people who need hospitals. Having more of an integrated workforce in the emergency department, where we're using doctors and nurses with all different types of skills from both the community, primary care and hospital services, mean that we're able to have a bigger pool of staff potentially that can provide expert care for all of the needs of our population. So it's about using our workforce in a much smarter way. There are a very small number of patients that require immediate surgery overnight, and often the best outcomes for those patients are being able to provide a large number of doctors and nurses to care for them and specialist equipment. By transferring that small number of patients to Bristol, we believe that they will get a better standard of care and a better quality of outcome. That's not to suggest that the doctors and nurses that work in Weston aren't providing a great service. It is just that they are limited by the numbers that we have at Weston and the equipment and infrastructure that we have around us. However, in return for that, what we're able to do is focus more on surgery in the daytime. That is both elective surgery, so planned surgery, but also some surgery for emergency cases that we can do in hospital hours when we have more staff around to look after patients. Therefore, we'll be providing better quality of care for a large number of patients, but accepting that a small number of patients might travel elsewhere, but in return receive a better quality of service and a chance of a better outcome.